Some types of heart murmurs have been given specific names, that is, they have been named after the doctor who first identified them. Let's go examine these soufflés together. The first murmur is the Graham-Steell murmur. The Graham-Steell murmur is caused by pulmonary insufficiency or pulmonary regurgitation due to pulmonary hypertension, and it was first named by a Scottish doctor. Therefore, the Graham-Steell murmur refers to a murmur caused by pulmonary insufficiency that occurs during diastole and is due to pulmonary hypertension. The next murmur is the Austin Flint murmur, named after Austin Flint, an American physician. In patients with severe aortic regurgitation, during diastole, blood flows from the aorta into the left ventricle, and this blood strikes the anterior leaflet of the mitral valve, causing it to become partially closed. As a result, the mitral valve becomes functionally narrowed. In other words, functional mitral stenosis develops, and this functional mitral stenosis leads to the presence of a mid-diastolic murmur. Therefore, the Austin Flint murmur is a functional murmur. The next murmur is the Carey Coombs murmur, which is a murmur caused by functional mitral stenosis. It occurs following severe mitral regurgitation in a patient with acute rheumatic heart disease, or in other words, acute rheumatic fever affecting the heart. Carey Coombs was an English physician who, about 100 years ago, was the first to identify this type of murmur. Therefore, in a patient with a Carey Coombs murmur, due to severe mitral regurgitation, blood enters the left atrium during systole, and this volume of blood, along with the blood arriving from the pulmonary veins into the left atrium, causes overflow again during diastole over a mitral valve of normal size. As a result, a functional murmur of the mitral valve can be heard. The next sign is the Gaudowardian sign. Gaudowardian was a French physician who was the first to discover this phenomenon. What is the Gaudowardian sign? If the murmur caused by aortic stenosis is also heard at the apex, that is, if the murmur from aortic stenosis is heard not only in the second intercostal space but also in the fifth left intercostal space, we call this the Gaudowardian sign. The next sign is the Carvalho sign, which means that the murmur caused by tricuspid regurgitation increases following inspiration. Dr. Carvalho was a Mexican physician who was the first to study this murmur. The reason for this is that during inspiration, because negative pressure is created in the chest, it causes increased venous return to the right side of the heart, which in turn leads to all right-sided murmurs, including tricuspid regurgitation, becoming louder. This is what is called the Carvalho sign. If you found the video helpful so far, please like it and share it with your friends. And if you don't want to miss my future videos, please subscribe.